Welcome to Educates on Alzheimer's disease. Alzheimer's disease is a degenerative brain disease and the most common form of dementia. It is a progressive disease that causes memory loss, confusion, changes in personality, and gradual loss of independence. The brain is made up of neurons or brain cells that act as information messengers. In Alzheimer's disease, plaques and tangles are formed that damage and kill these nerve cells. They block communication among nerve cells and disrupt their survival process, eventually causing the brain to shrink in size. The symptoms of Alzheimer's disease worsen over time, although the rate of progression varies. In the early stage of Alzheimer's, a person may still function independently. Despite this, the patient may have memory lapses, like remembering names, misplacing objects, and trouble with planning or organizing. Moderate stage Alzheimer's is typically the longest and can last for many years. Patient may be forgetful of events or personal history, feel socially withdrawn, unable to recall personal information like their address, telephone number, or school they attended, confusion about place, date, and time, trouble controlling bladder and bowel movements, changes in sleep patterns, demonstrates personality and behavioral changes. In the final stage of the disease, the symptoms are more severe. Here, the patient may require round-the-clock assistance with daily personal care, experience changes in physical abilities, including walking, sitting and eventually, swallowing, have difficulty communicating. They also become vulnerable to infections, especially pneumonia. Here are some risk factors associated with Alzheimer's disease. Age. Alzheimer's usually affects people older than 65. Gender. Women get the disease more often than men. Family history. People who have a parent or sibling with Alzheimer's are more likely to get it themselves. Lifestyle. High blood pressure and high cholesterol may also increase the likelihood that you'll develop Alzheimer's disease. Head injury. Some studies have shown a link between Alzheimer's disease and a major head injury. Here are some myths and facts about Alzheimer's disease. Myth: Alzheimer's disease and dementia are the same thing. Fact: dementia is an umbrella term for loss of memory and other thinking abilities that are severe enough to interfere with daily life. Although Alzheimer's disease is the most common form of dementia, it may also cover other medical conditions, such as vascular dementia, Lewy body disease, frontotemporal disease, and others. Myth: only elderly people get Alzheimer's disease. Fact: while most people with Alzheimer's are over the age of 65, the disease can also strike people as young as age 30. This is called early onset Alzheimer's disease, and it accounts for 5% of the total AD cases. Myth: flu shots can increase your risk of Alzheimer's disease. Fact: according to new research reported at the AAIC in 2020, flu and pneumonia vaccinations are associated with reduced risk of Alzheimer's disease. Myth: Alzheimer's disease can be treated or prevented. Fact: at present, there is no treatment for Alzheimer's disease, nor is there a way to stop its progression, but that doesn't mean there will never be a cure. Lifestyle modification may help reduce your risk for the disease. This includes controlling your blood pressure, eating a balanced diet, staying mentally and physically active, preventing head injury, getting enough sleep, and quitting smoking. Myth: if I'm frequently forgetting things, it must be Alzheimer's disease. Fact: not all memory problems equate to having Alzheimer's. Consult with your doctor to determine whether your memory changes are normal or a sign of something more serious. Remember, early detection of Alzheimer's disease can help you and your family maximize your time together and access resources and support programs. It also gives you time to plan for legal, financial, and care aspects while you are still able to. September is World Alzheimer's Month, which seeks to raise awareness and educate about the disease. The Alzheimer's Disease Association of the Philippines recently held its convention with the theme, "Dementia is a Priority in Unprecedented Times." To learn more about local resources, visit alzphilippines.org.